So as professionals, this is our last domain, we have to have knowledge, especially of things about the importance of confidentiality. Sometimes, especially working with youth, they're not ready for their parents to know yet. Okay, and we have to work on that with them. Understanding the ethical standards of care for trans folks and identifying gaps in our own personal knowledge as well as in the field. Like I can speak about, we know this, I can say we do not know that. Or I have to find out about that for you. I think there's information, but let me get it for you. We want to have the skills to negotiate multiple roles because I have both had to be the therapist and then go talk to the school and be an advocate or do a talk to the whole community of a school. So I'm in multiple hats that we get to navigate if we are advocating and helping and supporting our trans and gender diverse folks who we're working with. And we want to listen to and affirm the experiences of trans and gender diverse folks and promote deeper understanding in the field. And we have to have cultural awareness about the balance of non-maleficence and beneficence, like the doing no harm versus helping. So we want to be advocates. So we've talked a lot about the confidentiality, the ethical standards, staying up to date. I would encourage you in your practices to have universal approaches to correct pronouns. So training your staff so they're aware and have good interaction skills, maybe even have role plays with them. Have documentation strategies, as well as being aware of the family dynamics that are at play, working with the youth. And then please look at the bathroom signage, other signage, look at your forms if you have forms, or your website forms, your EHRs. If you're a medical provider, think about your physical exam sensitivities, signage, and staff member education, and always safety. So I want to close by saying there used to be a single narrative. People used to think they had to have a trans story that was the same. Transitioning male to female, female to male. They're attracted to the opposite sex, fitting that kind of that, trying to fit into that ladder of assumptions. But guess what? It's not true. And you're going to see that the more folks you see. So it used to be reinforced, but we want to let folks have a broader narrative and a broader understanding that it doesn't fit everybody, trapped in the wrong body. This body did a lot of great things in my lifetime. There are just some parts that had to get aligned. Not everybody's going to want to medically transition, and not everybody wants to move one binary gender to the other. As healthcare professionals, we can change the conversations where we work in the communities and with the folks we work with. That said, I thank you for being here.